So hello class, so we're going to talk about some infections that are caused by bacteria that can be treated with antibiotics. So some bacterial infection examples can include strep throat, urinary tract infections, some sexually transmitted infections, some pneumonias, and tuberculosis. Now let's take a look at penicillin. Penicillin can be delivered orally or parenterally. It's really frowned on to deliver penicillin topically because topical application of penicillin is the primary way to sensitize a patient, makes them more prone to having an allergic reaction to penicillin. Of course, delivering penicillin parenterally through IV or injection will give you the most serious allergic reaction, but the topical route is the way that patients are sensitized to penicillin. Penicillin is distributed through the body, metabolized in the liver, and it's excreted in the kidneys. Its mechanism of action is it kills bacteria. It kills them by destroying the cell wall of the bacteria. The bacteria can't build solid cell wall. Basically, the cell wall implodes or explodes, and the guts of the bacteria spill out. So penicillin is the first and one of the most effective antibiotics. And maybe in your reading, you read about sulfa drugs being the first antibiotic. Although sulfa drugs are not a true antibiotic, because they're not made by living bacteria. They're made a different way. So penicillin is the first and one of the most effective antibiotics. And penicillins are grouped into 4 separate groups. We have penicillin G, we have penicillin V, we have penicillinase, and look at that ASE. That indicates an enzyme. So we have penicillinase-resistant penicillin. We have the ampicillins, and within the ampicillin group, amoxicillin is there. And there's also extended spectrum penicillins, such as carbenicillin. So penicillin G, it's the prototype penicillin. When I say the word prototype, I mean the one to which all others are compared. It's given by parenteral, it's an injection. It's not absorbed well orally, and that's why it's injected. You might see penicillin G used parenterally in the case of someone that has gonorrhea, someone that is incapable or unwilling to take oral dosage of medication for an extended period of time, for a week or 2 weeks. You may see this used in a clinic setting that are dealing with persons that may be homeless, that have an infection, and they're not willing to take, they might not even be capable of taking and keeping or caring for oral tablets. So they may be treated with an injection of penicillin, and that penicillin injection would be penicillin G. Now penicillin V, also known as penicillin VK, its spectrum of action is similar to penicillin G, but this one is better because, well, not better, it's a little different because it can be delivered orally. And this one is the most common antibiotic given for dental infections. All right, so most dental infections are caused by bacteria that are susceptible to penicillin. So this is the most common antibiotic given for dental infections. Penicillinase-resistant penicillin. So what is that penicillinase? Well, those bacteria, they're pretty tricky, right? Bacteria have developed an enzyme called penicillinase. And guess what? That penicillinase destroys penicillin. Now, Some bacteria can naturally produce penicillinase, and those tricky little guys, some of them, when they're exposed to penicillin, can actually become penicillinase producers. All right, so now there are penicillins that are resistant to penicillinase, that enzyme that bacteria produce to inactivate penicillin. And the prototype is methicillin. Methicillin, you don't hear a lot about anymore, except in the case of something called methicillin-resistant Staphylococcus aureus. That is MRSA, right? So now bacteria are also becoming resistant to methicillin. The other two drugs, the cloxacillin and dicloxacillin, are the drugs of choice to be used with bacteria that produce the enzyme penicillinase, because these two, cloxacillin and dicloxacillin, are resistant to penicillinase. And ampicillin, and we talked before that amoxicillin is in the ampicillin group. These drugs are not completely natural. They have a synthetic component to them. Ampicillin and amoxicillin are susceptible to penicillinase. So, if you're treating a bacteria that can spit out that enzyme, it can destroy ampicillin and amoxicillin. Aha! But we have something to counteract that now. Amoxicillin, if you're dealing with a bacteria that produces this enzyme, penicillinase, you can mix something called clavulanic acid with the amoxicillin. The clavulanic acid does nothing except inactivate the penicillinase, that penicillin destroying enzyme. And I know you've all heard of this drug, or most of you have heard of it. It's called Augmentin. Augmentin is amoxicillin combined with clavulanic acid. And this is another important thing to note. Amoxicillin is the first drug of choice for prevention of endocarditis. Some of the adverse reactions to penicillins include allergy. All right, this is the big one. A lot of people, 5 to 10% of the time, we're going to see allergy. All right, anaphylaxis, this number doesn't look that big, right? 0.05% of patients taking penicillin will have anaphylaxis, but 5 to 10% of those people will die. That's about 100 to 300 people a year die because they have an allergic, life-threatening anaphylaxis due to penicillin. And this isn't just if it's injected. People have died from oral administration of penicillin. Toxicity. Penicillin is actually quite safe. People don't usually see an overdose with penicillin. You can have quite a heavy dose of penicillin and it won't reach toxic levels in your bloodstream. So dentally, penicillin, most common antibiotic for the treatment of dental infections. It's potent, it has a low toxicity, and a narrow spectrum. And we spoke in the last Camtasia, narrow spectrum is a pretty good thing, right? Because all antibiotics are going to kill the good bugs. We need to have some good bugs in our gastrointestinal tract within our body to help us and keep us well. And so a narrow spectrum drug will not kill off as many of the good bugs. Amoxicillin, first drug of choice for prophylaxis, and penicillin is effective against many aerobic and anaerobic bacteria. Macrolides. So macrolides are a drug group that consists of erythromycin, azithromycin, that's the Z-Pak, Zithromax, and clarithromycin, which is Biaxin. So I notice here I have IV twice, so I apologize for that. So how can you take macrolides? Pretty much every which way: oral, IV, intramuscular, topically. It's distributed to most tissues, it's metabolized in the liver, and it's excreted in the feces through the bile. Mechanism of action: it is usually bacteriostatic. It interferes with the protein synthesis within the bacteria, not within our cells, but within the cells of the bacteria. And the spectrum of action of macrolides closely resembles penicillin against gram-positive bacteria. Adverse reactions to macrolides: usually with therapeutic doses, they're okay. GI problems, upset stomach, nausea, vomiting, diarrhea, especially with erythromycin. Patients used to hate to take erythromycin. In years past, erythromycin was the second drug of choice for endocarditis prevention, and patients in a penicillin allergic patient, and it used to just rot patients' guts. They hated taking erythromycin. Clarithromycin, azithromycin are a bit better. They don't upset the stomach quite so much. So drug interactions, erythromycin has a lot. It slows down those liver enzymes. Slowing down those liver enzymes, right? They're not chewing up drugs so much, right? Someone's taking a second drug. They're taking one of these bottom list here, warfarin, all these drugs. These drugs can build up to toxic levels because those enzymes in the liver have slowed down, because that's what erythromycin do. So that second drug that you introduce into the body can become toxic. So what do we use macrolides for? So they're pretty much active against the same aerobic microorganisms as penicillin. It's the drug of choice against organisms in the penicillin allergic patient. Another important thing to know about macrolides: these drugs are not made inactive if a bacteria is producing that enzyme penicillinase. So they're not inactivated. They're not made not to work by penicillinase produced by bacteria. So the azithromycin and clarithromycin, now these are newer, the Z-Pak, Biaxin, so they have activity against gram-positive and gram-negative aerobes. And they have also some action against anaerobes. What people like about these drugs is we don't have to take them for 14 days. You don't have to take them for 10 days. Sometimes you only have to take them for 4 to 5 days. So patient compliance with taking these drugs is much better. So tetracycline, so it's orally administered with rapid uptake and distribution to most tissues. It's metabolized in the liver and excreted in the feces. It's also bacteriostatic. It also interferes with protein synthesis within the bacteria. So that's important to note. These drugs work on the bacteria. They don't work on our body systems. It's broad spectrum. Look at all these things it kills: gram-positive, gram-negative, aerobes, anaerobes. Remember, it's killing off some good stuff too, tetracycline, leaving the opportunity for things like opportunistic infections. So uses of tetracycline: it can be used, it's secreted in the gingival clavicular fluid, so that's kind of neat. It's used in localized, aggressive, and refractory periodontitis. It can be impregnated in a chip, that's perio chip. It's probably not used very much anymore. Or fibers, it was called actisite. It was actually a tetracycline impregnated fiber that you would actually enter into the pocket. The thing that we use is minocycline, which is a relative of tetracycline, and the minocycline, we enter it into a deeper pocket. So it's also used rarely. It can be used specifically for aggressive perio when someone needs antibiotic prophylaxis. So two things have to happen. A patient has to have aggressive perio. That's number one. Number two, they need to have an indication for antibiotic prophylaxis. They have a heart valve replacement. And additionally, they have aggressive perio. And the bug, and it's called AA, and I'm not even going to attempt to pronounce it. Someone can help me with that in class. This AA has been linked to causing aggressive perio and also having some link to endocarditis. So these patients take tetracycline for about 2 weeks because AA has also been perhaps linked, or it can produce penicillinase. So patients will take tetracycline for a couple of weeks prior to the dental appointment to lower the levels of this AA, and then on the day of the dental appointment, they'll follow the normal regimen, whether it's amoxicillin they're going to take, cephalexin, clindamycin, one of those drugs, the day of their appointment. So it's exceptionally rare. You have to have two things going on at the same time. I have not seen it very often at all. So medical uses for tetracycline include acne, COPD, and traveler's diarrhea. Some adverse reactions to tetracycline, right? It's getting rid of the good bugs, so it could upset your stomach. It's a broad spectrum, so we could get that opportunistic infection. You can get a yeast infection, basically. You could become have photosensitivity. What does that mean? You go out in the sun, you take a tetracycline, you can get a really pretty nasty sunburn. And then also the tetracycline, and when enamel is forming, can be taken up by the enamel, and then the person could end up with this brownish gray stain. It's permanent, it's intrinsic. So no tetracycline to expectant mothers, and to children probably about 10 and below. Tetracycline drug interactions. Now, if you have a patient that may have a seizure disorder and they may take barbiturates or dilantin, which is phenytoin. Now, barbiturates and phenytoin are liver enzyme inducers. They make the enzyme speed up. And then if you also introduce doxycycline into the system, doxycycline will get chewed up as well. So it reduces the effect of doxycycline. Tetracycline is a bacteriostatic drug. We don't want to mix tetracycline, especially with a bactericidal drug, all right? Because then you're going to have that lowered effect, that antagonistic effect. Bactericidal drugs need bacteria that are rapidly dividing, reproducing, and forming, and tetracycline slows that all down. Tetracycline also binds to ions, divalent and trivalent. So calcium, don't take tetracycline with milk, don't take it with iron supplements, and don't take it with Tums or Rolaids. You start mixing those two things together, tetracycline and milk, tetracycline and Tums, it forms a huge molecule in your stomach, and that huge molecule in your stomach cannot pass through membranes. It almost like makes the tetracycline not work at all. Now, clindamycin. Clindamycin, look, you can give clindamycin a whole bunch of different ways too. Oral, topical, intramuscular, IV, goes to the body, metabolized in the liver, and it's excreted in the urine and the feces. Mechanism of action, it's pretty much bacteriostatic. It can become bactericidal if you give a high enough dose of clindamycin. So some of the adverse reactions to clindamycin, GI, it can upset your stomach, you can get the opportunistic infection. The big thing that clindamycin is linked to is pseudomembranous colitis. Basically, pseudomembranous colitis is caused from C. diff, Clostridium difficile, that's normally inhabits our GI tract. You start killing off a bunch of the good bugs and C. diff can grow out of control. And what it causes within the body is severe diarrhea mixed with blood and mucus. You have a fever, you have pain. It actually makes a toxin that can destroy the lining of the colon. All right, and this has been linked to clindamycin, but please keep in mind, all right, patients taking any antibiotic can develop this pseudomembranous colitis. It's not just clindamycin, although it's more aligned with clindamycin. And we know that clindamycin is one of the drugs of second choice for antibiotic prophylaxis. So what are you going to do when all those good bugs are gone? We might be able to give you a fecal transplant. We'll talk about that in class. Now, cephalosporins. So cephalosporins are well absorbed. They go to all the tissues, metabolized in the liver, excreted by the kidneys. There are 4 generations available. And each generation actually has a broader spectrum of action. So they're bactericidal. They also inhibit cell wall synthesis, just like penicillin. And structurally, they're very similar to penicillin. And because of this similarity in their structure, if someone is allergic to penicillin, they will also have a cross hypersensitivity to penicillin. It's only about 10%. If you're allergic to penicillin, 10% of the time, you're also going to be allergic to cephalosporins. And cephalosporins are usually pretty easy to identify because they start off with like cephalexin, cef10. Almost all the generic drugs start with either CEPHA or CEFA. There's almost always a ceph there. All right. Almost all antibiotics cause some GI effects, but pretty much cephalosporins are pretty well tolerated. So they're indicated for infections. Cephalosporins are indicated for infections that are sensitive to these agents but are resistant to bacteria. They may be used also for antibiotic premedication. Metronidazole, FLAGYL. Now it has some anti-inflammatory effects which can be useful in treating periodontal infections. Metronidazole has a reaction when you combine it with alcohol. Patients that have or persons that have substance use disorder with alcohol can take a drug called disulfiram. It's also known as Antabuse. They take this drug, and if they consume alcohol, it makes them vomit tremendously. Like they are vomiting like crazy. So it kind of turns them off to alcohol. FLAGYL has the same kind of effect. So you might see it called a disulfiram-like effect. You take FLAGYL and you say, I'm going to have a couple of drinks tonight. You are going to be throwing your guts up like crazy. Not a good combination. The other thing, FLAGYL is associated with sort of like a metallic taste. It can give you a metallic taste in your mouth, and it can also dry your mouth.